session as a keynote speaker. Of course, I congratulate Dr. Edward sir for his excellent thought about education and also in AI use, okay, and how is this transforming. The same concept, okay, we will see in medical sciences as an evidence-based practice and research and transforming patient outcomes. In today's this keynote speaker, we will see about what about evidence-based practice means, different definitions and components, why we need it, okay, and how it is transforming the practice of health sciences, and how research is contributing to upliftment of an EBP, and how to cultivate it. And I conclude with the summary. Evidence-based practice is having a very great contribution for bringing in positive changes in the outcomes of a patient, okay. So we'll see that on how it is effective in different fields of health and other sciences. First of all, evidence-based practice is a systematic approach to clinical decision making that integrates the best available research evidence with clinical expertise and patient values and preferences. Always keep it in mind that on whatever we are giving as an interventions, okay, as in treatment, it must be having within a stipulated or a constrained input, we have to get a very good satisfactory output, okay. So this is the best evidence, means what interventions we have to give. It determines on the basis of an research which is having a very appropriate one. And also we have to consider the clinical expertise and also the patient values, okay, from where the patient comes, what is his thought and what he wants, whether he wants to avail or not. It emphasizes the use of an high quality research to guide clinical practice and improve patient outcomes. So if you see in an EBP or an evidence-based practice, okay, it is the assessment of a research evidence, what you are getting it, okay, through different analysis, a consideration of the individual patient's needs and preferences, and the application of an clinical judgment done by an practitioners. If you see, if you combine this one, okay, then we will get a very good output. So evidence-based practice, okay, it includes an individual clinical expertise, how much they know by different ways of doing it, and their own years of an experience. And through the research, whether the taking of a decision to intervene it, okay, the interventions which best suits depending upon the values and expectations of the patients. These are all three components will compromises the evidence-based practice. So this will helps you to enhance the patient outcomes, think that one to reduce the cost and for the early recovery. Promoting accountability, we need an evidence-based practice which helps you to know that now who is an accountable, okay, and their role, and it enhances the resource efficiency, which means the resource efficiency, it enhances by having it in input as in lower and the output as in a very quality based. So if you see in overall in the modern healthcare, EPP is having different spheres of its significance. As in first, as improved patient outcomes, it enhances recovery rates through scientifically proven methods. Okay, think that one whenever overall having to reduce it in IMR, MMR, okay, the mortality rates, implementation of an evidence-based sepsis protocols, okay, in an ICU, in an ward, in an hospital-acquired infections, okay. It reduces the mortality rates by 30% in an intensive care units globally. Okay, this is the one of the case study. It shows that one EBP is very effective. Then increased patient safety prevents errors by adhering to best practices, because we know that one which is the one which we can apply it on a patient's therapeutic beneficence. Hand hygiene protocols based on evidence have significantly lowered healthcare associated infections. This is very, very common that we have to know that on what type of hand washing is needed, whether it's in medical or in surgical, and how it reduces. Next one is cost effectiveness. It decreases healthcare cost by avoiding unnecessary interventions and hospital readmissions. Okay. Like in an evidence-based vaccination programs, there are so many vaccination programs are there. Like in, of course, new vaccination programs. Okay, will reduce the economic burden of preventable diseases, especially for the cervical cancer. Okay, and other diseases. And also cost effectiveness, think that on the indigenous use, okay, of an evidence-based practice of an yoga and mindfulness and other interventions will reduces the actually chronic diseases, what you call in sedentary diseases. Okay, this will helps you to enhance the lifespan, also the quality of an life. Enhanced healthcare efficiency, it streamlines clinical workflows by standardizing care protocols, what to do, how to do, in which settings. Use of clinical guidelines in emergency departments shortens the treatment times and improves the resource allocation. Very, very important. This is a research based or an evidence based. Think that when the patient comes with a snake bite, okay, what's the protocol we have to follow at an PSC, at a clinic, at a very higher centers. Okay, what's the protocol that has to be adhered to it? This will helps you to make the patient or a recovery in a very good way, in a holistic way. Professional growth and accountability, it promotes lifelong learning and critical thinking among healthcare professionals. Whatever you are doing it, okay, the interventions we need and research. Research comes with best evidences. It encourages accountability through adherence to validated practices. So how we can go for it? What's the process of an EBP? Okay, it is having, asking, acquiring, appraising, applying, and analyzing. Ask it. Okay, start with a clear, answerable clinical question based on patient needs and relevant to current practice. For example, think that on nowadays the diabetes 2 is an very prevalent, whether this metformin, okay, is more effective than sulfonylureas in controlling blood sugar levels. Okay, otherwise also, what are the other measures often controlling the sugar level? For that one, you just do in review. Okay, acquiring, search for relevant research evidence from reputable sources. Go for an very high impact factor journals. Use of an AI will help you, especially our research genius and research and general finders. These are the things you can make use of it. Then you can find out that on which journalism gives on a diabetes 2. Okay, for example, that the relevant things. Okay, clinical trials, systematic reviews, and meta-analysis, you can go through it. Then you can analyze that one, which is the best one. You can come to a conclusion. Next one is appraising. Critically evaluate the quality and relevance of the evidence, assessed by study design, what they have done, whether it's in qualitative study or in quantitative or in mixed methods, sample size, whether they have gone for an generalization or not, and the strength of the findings. Okay, whether it is a tested one or not, whether the protocol like an hypothesis testing is having a very strong evidence or not. This you have to analyze it. Next, from this one, when you will see that one which is an appropriate, you can try to apply it. Integrate the evidence into your clinical decision making, considering the patient preferences and contextual factors where you are doing, whether you are doing in the community, whether you are doing in the hospital or any other settings. Modify your practice based on the evidence. Okay, this intuition the practitioners must have. Next, you can analyze it or it is the output. Continuously evaluate the effectiveness of your decisions and adjust your practice as needed based on evidence and patient outcomes. So the EBP process is having, asking, acquiring, appraising, applying, and analyzing. So whenever you apply this model, okay, definitely it gives rise to patient outcomes with the very, very minimal input. It reduces MMR, mortality and morbidity. It shortens the hospital stays. Okay, there is no need to be there for an 1 week. Okay, within 1 or 2 days, you can make discharge of the patients, and it automatically improves the quality of life of the patient and also in others. It helps you to for in clinical decision making because it is the best evidence. Okay, you are in analyzing it, and also with the practice and the consideration of the values of the patient. Okay, it helps you to make a very good quality based decision. Increased efficiency and cost effectiveness because you are taking out the cream or in what you call in the crux of the research findings, which is in best suits to do the good things on the patient. Continuous quality improvement will be analysis from the evidence-based practice. Then now we will see how this research and how to practice it. Okay, EBP. Research is the cornerstone for an evidence-based practice as it offers scientific basis for making informed decisions. Okay, whenever you are taking any decision to do it, how we will do by the best evidence. Okay, but how this best evidence occurs through continuous research. So we have to generate an evidence. For generating evidence, we need a research in the form of an RCT, randomized control trials, having systematic reviews, meta-analysis. Also, this conglomeration of these papers, okay, or these results will helps you to know that one what type of an interventions, treatment, or an strategy I can follow it on my patient or in wherever I am working it. Validation of an clinical practices. Research evaluates the effectiveness and safety of an healthcare procedures, ensuring they deliver the best outcomes for patients. Okay, studies improving the efficacy of an early mobilization in reducing ICU patients' recovery time. Of course, because you see that whenever the patient there in more time in an ICU, more chances are for the different complications like an hypoxemia or an acquired infections, okay, nosocomial infections. So this will be reduced by having in mobilization, and that improves the overall physical and mental health because of the mobilization, early mobilization. Guidelines and protocols, research findings are synthesized into clinical practice guidelines, offering evidence-based recommendations for managing specific conditions. Think that one, if any patient comes with an organophosphor poisoning, okay, or by suicide, what are the things we have to do it at the first can be done by best evidences through research. Adaptations to emerging challenges. Continuous research addresses new diseases, technology, and treatment options, ensuring EBP evolves to meet current healthcare needs. We have seen that when COVID-19 has occurred. Okay. Support for shared decision making. Research provides the data needed to present patients with options, fostering collaboration between clinicians, patients, and treatment planning. Earlier, it was an things of an usually individual based, but now it is an what you call in the conglomeration of an other experts, mainly to focus on the patient's outcome, very good outcome. Benchmarking quality and outcomes. Research helps compare the effectiveness of different approaches, setting benchmarks for best practices in healthcare. Of course, you have seen that one qualitative studies, quantitative studies, on mixed methods of studies of in different geographical area or in different designs. Okay, when you'll combine, when you'll go for the best one to take on the time, it helps you to reduce many things. So we have to integrate the research evidence into clinical decision making. So identify the relevant studies. You can go for an clinical studies or an databases like in PubMed, Cochrane, library. Okay, CINAHL is there, consensus and other things like in this different databases. Okay, and use of an AI will help you get the relevant studies. Assess study quality, how they have done it. Okay, evaluate the methodology of the research, ensuring it is reliable and relevant to your clinical practice. So you can choose the related things. Okay, like an AI identifiers, like in our eudoxia research and general finders. Okay, when you put thought that one what type of an interventions you have to give, and how to come to know that one this is the best evidence. For that one, you can do the review, you can make use of an AI here. Consider patient preferences. Incorporate patient values, beliefs, and preferences into your decision-making process, ensuring their needs are met. Okay, because if you see that one, whenever you are taking the best decision, okay, in a cost-effective sense, we have to consider their background, the patient's background, their education level, their values, their culture. From there they came, whether they can afford it or not. This also matters a lot. Apply the evidence. Implement the findings of the research into your clinical practice, tailoring the approach to the individual patient. Okay, whether they can follow it or not. Okay, so for this one, you can use one of the very common model that it is known as an PICO model. For an especially in nursing sciences, if you want to apply, okay, this EBP, you can use this model like in very simple one. uh, PICO is nothing but patient or a problem, okay, intervention, comparison, and outcome. Population means the health of an interest, okay. Intervention, what you are giving it, or an exposure, drug, surgery, policy, community program, etc. Okay, then you can compare it whether the traditional one, and if I have this one, whether it is an effective or not, you can compare it. Okay, you can contrast it, then you can see by applying it the outcomes, whether it is an fruitful or positive or negative. Okay, these elements helps to define and refine the clinical question and guide the research for relevant research things. So you can go for PICO model. So first and foremost, formulate the question, identify the keywords, okay, the what you call operationalize it, plan for the things, collect the reviews, research it, okay, then refine the results, go for an review of literature, then you can find out the best evidence which helps you. So for an to get in best evidence, you can follow the PICO model, but it's not in so practically is in applying it. Okay, because of the so many constraints will be there, challenges are much more, maybe lack of time, because of how much time a practitioner will spend to go for research, for reviewing the articles to get the best practices. Okay, and limited resources, maybe lack of knowledge, okay, and lack of connectivity or in getting the sources, lack of training. Many people they may not be knowing that how we can get the best resources. Okay, resistance to change. Already the traditional way they are doing it, I will also follow. I don't want to have the newer thoughts of an intervention. Then organizational culture is very important. How much overall the administration plays an very important to go for an research and implementation of an EBP because of their so many factors like an economical status, the philosophy, and their arena of an working out. Okay, so leveraging technology to support EBP here, AI will plays a very important role. Clinical decision and support systems. This will helps you to get the related things about the patient care, alerts, reminders, and recommendations. Okay, the AI will helps. You can maintain the electronic health records because of an you can track the things. Otherwise, it is very difficult. Sometimes patient may forgets to bring it. When you are having electronic records, it is very easy to assess it. Mobile apps and other resources are available now to go for it. What is the now how it is in supporting, okay, AI, especially AI and machine learning. AI analyzes fast data sets to identify patterns, predict outcomes, and personalize care. Okay, AI like can predict to medicine, predict to surgical things. Okay, predict to health outcomes. AI tools like an IBM Watson assist in diagnosing cancers and suggesting evidence-based treatment plans. Okay, depending upon personalized one. Next one is clinical decision support systems. They provide healthcare professionals with real-time evidence-based recommendations like an up-to-date is there. Okay, integrate research findings into clinical workforce to guide treatment decisions. Big data and analytics, aggregate and analyze population level data to inform policy and improve patient care. Okay, like in predictive analytics, they will help you to find out the high risk patients. Okay, and how you can control it or overcome it by early interventions. What they have to do, reducing hospital readmissions. This is more, especially in chronic cases. Okay, it is an alarming. Telemedicine and remote monitoring, this is the very newest way often doing it, because you see the population and the expenses of an health expenses are on much more, even though we are having third party payments, but most 50 to 60% of the population, world population, they cannot afford for a very higher cost. Okay, so this telemedicine is the best source of to reach out to them. Facilitate the application of an EBP in remote or an underserved areas by providing virtual access to evidence-based care. Yesterday, we have seen session on how this telemedicine is changing the scenario of an healthcare. Okay, telehealth platforms enable consistent implementation of chronic diseases management protocols, especially those who are nowadays what we are non-epidemic diseases. Okay, can be monitored and through this telemedicine and with the apps. Electronic health records will help to support evidence informed clinical decisions on current guidelines. But you have to cultivate the culture of using an EBP, evidence-based practice, for all the healthcare practitioners and also for an organization, because it is a combined effort. It is an amalgamation of different professionals and also with the public. So we need a leadership support. Organization leaders must champion EBP by providing resources, training, and incentives to encourage its adoption. Okay, whether it is in primary health center or in a community health center or at an hospitals. Okay, when very high tech hospitals. Okay, EBP training and programs, everybody has to know that on what it is, how it is. Okay, how we can bring it to the patient level. Okay, at a personalized level. So they who have to teach them, the stakeholders of an healthcare providers, about the skills and knowledge necessary to practice EBP. So we have to enhance. We need an upskilling of an healthcare providers. Collaborate research initiative, promote collaborative research projects to generate new evidence and improve clinical practice. How? Like in institutions like in an EDOXIA, we deal with 193 countries, often different people. So how can use this one EBP? Okay, how we can collaborate can be taught here, or in this is the chance to enhance and disseminate the findings and to discuss it. Performance monitoring and feedback, track and monitor EVP implementation. Okay, how much it is for they succeeded, for regular feedback to clinicians and identify areas of an for improvement, in which area is needed, whether it is on grassroots level, at a mid level, or at higher, at an practice level, at an what you call in bedside. Okay, clinical bedside, at a treatment, at a rehab. You have to look into it. Cultivating a culture of an EBP requires sustained efforts from both clinicians and organization. I told you that one, it is an combined effort. Okay, by implementing these strategies, healthcare institutions can create an environment that embraces evidence-based decision making and drives continuous improvement in the patient care. So, if you see in overall, EBP, it includes clinical expertise, mainly patients' preferences, and the best available research to enhance healthcare decision making and improve patient outcomes very qualitatively. Of course, we have to use different methodologies, and we need an robust data, real world data, which helps you for the effective treatment outcomes, or also in patient needs as an individual one. Its transformative impact lies in promoting high quality care, reducing variability in practice, and optimizing resource allocation. Of course, this will help you for the innovation, enabling healthcare providers to adapt emerging challenges. Because if you see today, even though we are having very high-tech hospitals, high-tech doctors, high-tech care providers, like this only, but we fail to have the objectives, okay, of an health for all, for an these things, and SDGs are still we are suffering. In conclusion, if you see this one, EBP serves as a cornerstone for modern healthcare, driving superior patient outcomes through informed, data-driven decisions while fostering a culture of an continuous improvement and patient-centered care. If you want to achieve health for all and SDGs, okay, related to health, we need a best evidence which comes from the very robust research. With this one, I end today's session. Thank you, one and all. Thank you.